Well, we spring forward on Sunday morning, but you should be getting you and your kids ready now, I should say. Dr. Mohsin Maqbool is the medical director of the Pediatric Sleep Institute in Plano, and he sees this a lot this time of year. When we lose an hour of sleep, it affects us.
It's rough on the body and the brain when we have to lose an hour of sleep. So spring, by that virtue, is the tougher time for brain and the body, as it is evident by a higher risk of heart attacks around the same time. There's higher rates of miscarriages. There's higher rate of accidents at workplace, people slacking, low productivity, just depression. During spring, what I usually advise my families, my patients, my kids, and their parents is to be prepared and start going to bed 15 minutes to half an hour earlier, 1 week before the time change, so that when the time actually changes, it doesn't hit them that hard, because no one is immune to it. Some people are more prone to these effects of loss of sleep, but those who are, you can tell, and they present sometimes clinically in the clinic setting that I see. I treat anxiety, depression, and ADHD in children, and I see high rates of these conditions around springtime.
We're all consumed by our electronics, our phones, our video games. As it relates to sleep, what advice do you have about electronics and sleep?
This is kind of the continuation of the relationship between brain and light exposure. When brain is exposed to light at a certain time of day, it is going to yield a certain consequences. Just like we treat depression or seasonal affective disorder by exposing the brain, the eyes, to bright light during the daytime, conversely, similar exposure at nighttime, it is going to delay a person's sleep time. So it's more like a recipe for insomnia. And the other part is very much based on conditioning our brains to more excitement, drama. That's what we watch on electronics, TV shows, videos, and socialization, social media, etc. So we are, in a way, priming our brains to excitement at the time, which is often is the opposite of excitement. It should be a winding down time, not the winding up time. So by limiting light exposure and exposure to any multimedia, 2 hours before bedtime is a general advice that I give my patients.
That is Dr. Mohsin Maqbool, the medical director of the Pediatric Sleep Institute in Plano, as we spring forward coming up this weekend.